Okay, I'll go on and add now. All right. Thank you. Good morning, everybody. We're going to get started in a minute for Lipedema Awareness Month. Wonderful. We're here. Hi,
Hi,
Hiba.
how are you?
Good to see you. I'm well. How are you?
I'm doing well.
Thank you to everybody who has joined so far. We're here for Lipedema Awareness Month, and we have a few more people coming in. I'm excited to see them coming in.
Yeah.
We'll give them a couple minutes. Wonderful. I'm really excited for our conversation today, and I'm really grateful for some of the feedback, even just from sharing our posts that we have leading up to this, feedback that we're getting already, getting the conversation started, and it's been really great getting to know each other just online
It has
so
been.
far. And yes, and I'm excited to facilitate this conversation too, so that during this month that we have the opportunity to build education, build empathy and awareness. It's so important, and I appreciate your willingness to share your story.
Thank you very much for having me. You know, it's exciting. I've been catching up on some of the other lives that have been posted from the Lipedema Foundation, and it's just been so wonderful to just hear everybody's different stories and to hear perspectives, hear education. Just it's been wonderful to see. I'm excited to see what the rest of the month has in store.
Great. Well, let's go ahead and get started. So we're going to be asking and answering some questions.
Sure.
Hiba's going to be sharing some of her own personal journey. So thank you, everybody, for joining in. Feel free to comment and chat as we continue this discussion. One of the things in learning about lipedema myself, as an autoimmune survivor, is really understanding that we probably all know someone who has it. And I really
Absolutely.
want to get to understand, what was kind of your aha moment in your journey, and what did that look like?
Yeah, so for me, I self-diagnosed back in 2020. So I had actually heard about or read about lipedema in probably 2017, 2018. But back then, some of the resources that I had found online, they shared some pictures of what, women who have it look like. When I looked at those pictures, I thought, well, that's not really me. I mean, I really don't have all of these symptoms. So I dismissed it initially. But then, probably in 2020, a random Google search got me to a page that showed, I believe it was actually the picture that the Lipedema Foundation uses that has the different women's legs on it. And I saw a pair of legs that looked like mine. And I think that realization was that it wasn't just one type of look, one type of body type, but it came in many different forms. And so I just started, I just need a thread. I'm a researcher. I love to research and read and find out. So I just needed one little thread to pull on. And once I pulled on it, boy, I I unraveled quite a bit. So unfortunately for me, it was a self-diagnosis excuse me, initially. But after that, I started seeking out doctors to help me get an official diagnosis, which I was able to get in 2021.
So it was about a year journey from when you started noticing to when you actually got that diagnosis.
Yeah, it took a while. So during that time, I'm so thankful for the lipedema community. The social media community is what kept me going that year because that was all I really had. I mean, when I had reached out to the doctor that I was seeing at the time, he really didn't have any answers for me. And so I kept just coming back to the community. I would join the different lives. I would watch the different webinars. Anytime there was somebody who had posted something about a doctor they had seen or a surgery that they had had, I would follow along and see who it was and research that doctor. And so that's what led me to get my official diagnosis. But unfortunately, for a lot of us, that's the story, that we have to do this ourselves, which is why Lipedema Awareness Month is so important, because we have gone through that and we have found answers for ourselves, and all of us are eager to share them with others who are questioning it and wondering what's happening with them.
So I'm hearing two really important themes, the self-advocacy and then also community. And this is exactly the reason why we're here on Instagram Live, because, being online on social media, we hear some of the pitfalls, but also on the bright side, there's the ability to find community, to get answers when there's symptoms or things that you're noticing about yourself, to be able to go online and not feel alone. So I appreciate you touching on those 2 points.
Yeah, absolutely. What's interesting is that anybody that I met during that time, and even now that I ask a question to, I, have a follow-up on, everybody always responded back and wrote back like paragraphs, right? Sharing all of their, sharing what they know, sharing their knowledge, sharing their experience. And that was so just heartwarming to me. First of all, to have an idea of what was going on with my body after decades of having no clue what was happening, to have some answers, and then to have people who are experiencing it as well. And then those people are so willing to share and are so kind and loving and just compassionate. Like, it was just such a breath of fresh air. And it was that's why I'm so excited about this month, because that's what we should all be doing. We should all be spreading that awareness as much as possible, because we have answers now. We don't have all the answers. There's still a lot that has to be done. There's still a lot of research. There's still a lot of great work that's being done, but we have a lot of answers to at least get started. And so to at least help women get that initial diagnosis and put them on a path that gets them as healed as possible.
And to that point, I was kind of curious, when you started to notice your own symptoms and get the diagnosis and go through that journey, did you start to build awareness just out in the world and noticing how common lipedema was? What did that look like being out in the world?
Absolutely. What was interesting, as soon as I recognized it, I started seeing it everywhere I went, right? I would see somebody who had the walk, right? There's a very specific lipedema walk. There's a very specific kind of gait that we have, unfortunately, because of the placement of the nodules in our legs and how it just changes our gait. But I started to see that quite a bit. But what I started to do, because to me, the important part is to help with educating doctors as much as possible. So I spent quite a bit of time finding a team of doctors to help me manage all of my symptoms and all of my, various chronic diseases. And one of the things that I would first do anytime I would see a doctor is I would print out the US standard of care for lipedema, and I would take that to the doctor's office and I would give it to them. And their response to that document and me giving them that document told me everything I needed to know about whether or not this was a good doctor for me. Because the ones that asked questions, the ones that wanted to know more, the ones that were open to the idea of there's something I don't know about, those are the ones that I wanted on, on my medical team. So the other thing that I started to do was just anytime that I would go to the appointment, I would just bring up if there was some interesting piece of research that I had read, or if there was some latest news that I could share, I would share that with the doctors as well. And, my primary care physician, my cardiologist, my endocrinologist, all of them at my follow-up appointments always ask me questions like, what have you read? What have you seen? And so they're asking and more involved in it. And it's really been helpful to me, because I think that they're seeing a lot more people that have this than I do. And so if there's at least one person that can be helped through this doctor knowing something through me, then I'm happy to do it.
So you've really become an advocate in that regard, where you advocating for yourself is directly impacting others who may be seeking answers, and that in the medical community that there obviously is a gap in information on their end. And I think you could go one of two ways. You could, get really upset about that, or you could say, I'm going to make it better.
Yeah. So you know what, this is, I'll be honest with you. I went through a period where I was just raging. I mean, I was just angry, because for decades, I had been dismissed by almost every medical professional that I had seen. And for looking back now, for decades, there were signs that there was something that was going on with my body that was not not as it should be, and they were all just dismissed and ignored. All of my all any kind of question that I had, any kind of, you know, I've been doing all of these things and never lose weight. Why is that? Well, I had a doctor who would tell me, you can lie to yourself, but you can't lie to the scale. And this is when I was in full blown, like eating barely nothing, working out 2, 3 times a day. And this was his response. And so for having decades of that and having experiences like that for 20, 30 years, either I do something with that rage of somebody should have done something for me. I either need to do something with that or it's going to destroy me. So I've decided I'm going to take that rage and I'm going to point it and put it into a direction of helping others, of helping other women not experience this, because then I can feel like what I've gone through in these last however many years, it at least it's worth something, right? It's done something, it's brought some good into the world, and so that helps to alleviate some of that rage.
And I think that gets into the next point, just with general quality of life and the mind-body connection. And if you're comfortable sharing, what were some of those symptoms and maybe some of the more challenging physical symptoms that you've noticed that you'd be willing to share with the community?
Yeah. So for me, there were a handful of things where when looking back, I can see when the lipedema flared up in my body. So the first was I could really feel it in my legs. And I saw a very, very abnormal growth in the size, especially my calves and just lower legs, especially in a very, very short amount of time. And during that time, I also realized that, so I've always been larger. Like I was a chubby kid. I basically looked like this. I mean, red lipstick and all, like 2 years old, I still look like this. But I was just a chubby kid. And like, as I was getting older, I really never outgrew that. But there was a period probably in about 2016, 2017, where I noticed that my legs were growing much, much larger than the rest of my body. So even though I hadn't really gained a lot of weight on the scale, like the size of my legs had grown quite a bit. My arms had grown quite a bit, but they were also heavy. I love to travel. I go all over the world. That's my thing. And I noticed, I was having trouble like pulling a rolling suitcase through the airport. I am somebody who does not pack light and I love to shop. So I'm always going through airports with like as many bags as possible, and it never slowed me down. And there was one trip where I was pulling a small carry-on, and by the time I got to the gate, I was in tears because my arms hurt so bad, my legs hurt so bad. So I had a lot of just heaviness and pain. And then I felt the nodules. So the nodules started coming probably about 2016 is when I started feeling, it went more from like heavy into just like I could feel just like small rocks under my skin. And then they just started growing and growing and growing. And then probably about 2020, when I diagnosed myself, that's when I really started to see a loss in mobility. I used to be able to walk for ages without blinking an eye. I would take spin classes, not a problem. I'd spend an hour on the elliptical without blinking an eye. And I was having a hard time standing for long periods of time. I was having a hard time just completing housework, just getting, up and down stairs. It really shocked me at just how much my mobility was affected in a relatively short amount of time.
And what does management of that look like for you, as far as seeking out treatments and help?
Well, so when I came across the standard of care for lipedema patients in the US, I looked through all of those treatments, like the conservative treatments, right? So I started wearing compression, I started going swimming, I started doing the manual lymphatic drainage massage, I got a vibration plate, I got a fascia blaster, I started doing the things that were listed in there to just help help soften fibrotic tissue and move some of the fluid. So I started to do those things and saw some relief with that, but it was progressing a bit faster than I was willing to accept. So I started exploring some other options.
And with your mobility, where are you at right now? What does that look like? Oh, did we freeze?
There we go. I'm back.
There you go. I was asking about with mobility currently, when you're talking about the challenge that you face. What does it look like for you currently?
So currently it's much better. So after a lot of research and a lot of just talking to doctors, surgeons, I decided to go down the path of surgery. And that was not a decision that I made lightly. That was the right decision for me. But I know that that is definitely something that is a very unique decision for everyone. And it's not, it's not a one size fits all for everyone. But I did have my first surgery back earlier, let's see, in the fall. And since then, I've seen quite a, and increase in mobility. I'm actually on vacation right now, and I think we've been averaging more than 15,000 steps a day, which is pretty aggressive, but I've been able to do it. I've been able to keep up, and I think I'm tired. I'm not going to lie, I'm tired, but I think anybody would be tired at multiple days at 15,000 steps. So mobility has definitely gotten better.
I love that you share how much you love to travel. And I think in just learning and preparing for this conversation, understanding the stigma and shame that's often associated with lipedema and the fact that you're out there and you're living your life, I really appreciate that. Has that been a journey to get to that point? Or did you notice, what were some of the things that you encountered?
Yeah, I'll be honest and say that it's only been recently that I've had kind of that freedom of just living my life the way that I want. Because for a very, very long time, I was ashamed of this body. And I was ashamed of the fact that no matter what I did, I couldn't lose weight. No matter how much I dieted, no matter how much I exercised, there was nothing that I could do to get my body to look like it should, right? And I hid it. And I always postponed things until I lost a little more weight or until I felt a little bit better or until I looked a little bit better. And I finally reached a point where I don't care. I'm not giving up all of this. Like, we have a beautiful world at our fingertips, and I'm not going to give it up waiting for this body to look a certain way. This body is strong, it's capable, it's worthy. I'm going to take it. I'm going to take it all around the world. I'm going to enjoy it. There's no more hiding. Hiding is a thing of the past. And I think that's the biggest eye-opening thing for me in having found this community, is to see all of these women who refuse to hide and just live their life fully, authentically, how they want to. And I absolutely love that. And that's how I want to be.
I love that you say that. And I think part of it as well is just the past couple years that we've all lived through, right? And that there's this hunger and this need to want to be out there and not to limit yourself.
Yeah. I mean, when we're all stuck, during the pandemic, we're at home, I just think back and I'm like, I had these opportunities to do these things and now I want to and I can't, And so I resolved there's no more waiting. There's no more hiding. There's no more shame. This body we're taking it all over the world.
I want to go back to your point about self-advocacy for a bit. For those who are watching that are kind of curious that either they might be noticing symptoms or maybe they have a loved one, were there key questions? I know you mentioned bringing the actual document to your doctor's office, but were there any key questions that you'd want to consider telling people to start to ask? Possibly if they're getting misdiagnosed or getting dismissed, which is, we know that's a big concern as well for women's health.
Yeah, so the Lipedema Foundation recently released a great patient advocacy guide, or self-advocacy guide, that has an amazing list of questions. When you go to the doctor, asking very specific questions about the symptoms that you're having, and if diet and exercise is the only answer, to push back and say, okay, if I had a normal BMI, which we know is not not the best tool to be using, but if I was a normal weight, what would you tell me? What tests would you run? Take my weight out of the equation. What tests would you run if I was a normal weight? Because that, unfortunately, is a question that we need to ask, because anything is somehow tied back to weight loss and diet and exercise, anything. So starting with just that question of if I didn't weigh what I weigh, what would your advice be? What would you tell me to do? What tests would we run? The other is to just not be afraid to just leave. If a doctor is not serving your best interests, it is 100% okay to find somebody who will. Because look, I will say that doctors are absolute experts in bodies. They know bodies inside and out. I'm an expert in this body. We are experts of our own bodies. Together, the doctor's expertise and my expertise should be unstoppable. But if we're just going to talk about their expertise and what they know and try to apply it without knowing what my body is and how my body reacts, that's where we're going to have problems. So just acknowledging that and not being able to stand up, or not being afraid to stand up for yourself and say, this isn't how I want to be treated. I'm not getting the answers that I want, and finding another doctor. And for some people that's hard. I mean, there's, depending on where you are, you might have limited options. And so you'll have to kind of advocate in different ways. But if you have options ahead of you, then by all means, you should explore them until you find the right person that should be on your medical team.
And to that end, I think what you're offering to the listeners is a lot of hope. And I think one of the things in that regard, just from a data perspective, I was surprised to learn that over half of the peer-reviewed research has only come out about lipedema in the past 4.5 to 5 years, which I was shocked to read that statistic. But I think the fact that now we're having more awareness for people who may have 10 years ago, 5 years ago, noticed symptoms, now we're coming into a period of high information about the disease. What has self-education looked like for you? I know you've gone on the website and you're doing, watching conversations like this. You can just go down the path of Dr. Google, I'm sure, but strategically going down that self-education path, what were some of the key resources, that we can pinpoint for the listeners?
Yeah, so I think all of us at some point in our journeys ended up just doing a deep dive on Dr. Karen Herf's work. I mean, she has done incredible work for decades in the lipedema community. And I think one of her articles is one of the very first ones I found when I did my Google search in 2020. So I think she does a lot of amazing work. So anything that she's publishing or that she's tied to, I think is wonderful. The Lipedema Foundation is also an incredible resource. I mean, seeing all of the patient advocacy guides and just guides for patients, but also the research that they're funding and helping to sponsor is absolutely incredible. Starting in those places, there's so many different foundations that are doing, or lipedema foundations that are doing great work. Starting with those, everybody is sharing resources. Social media is not a place to overlook either. I mean, some of the Facebook groups that I find, it's fantastic because there's women who are nerdier than I am who are like finding things that I don't find, and I'm like, ooh, well, I know when there's like two women that I see regularly, I'm like, when they post, I know it's going to be a good article that I'm going to have to dive into. So there's a lot of different resources that you can tap into. I think it's also whatever level of detail you want to get into. For some people, that can be very overwhelming. So if that is you, you don't have to do a deep dive on all of it. If you are somebody that needs all of the details, if you need to know all the nitty gritty why and how it's happening and what's specifically happening and all of that, then research, deep diving into research is for you. But I think that there's a nice range across that spectrum of how much you want to do to just get a deep dive on. Also, this year was the first year that I attended FDRS, so the Fat Disease Resource Society Conference, which was fantastic. There was an entire day that was dedicated to just research and talking about the latest and greatest news. And that was so, for me, I loved it because it was a lot of data and numbers and research, which was fantastic. But also it just gave me so much hope to see so many people who aren't affected by this personally, so invested in helping our community. It's one thing when when we're invested in it because it's affecting us daily or it's affecting somebody that we love daily, but to see so many people who are dedicated to helping the lipedema community and to helping us figure out, better treatment options and figuring out how to hopefully, reverse and stop the progression of this disease. I mean, it's very, very uplifting and inspiring to see so many people who are dedicated to that.
And I think you play an important role, in that conversation, and even just spending some time on your blog and your Instagram. What was that decision like? Because like you said, you can deep dive into education, you can go shallow, whatever, but that decision to share your personal journey online and being vulnerable, what was that decision like for you?
So I'm typically a private person. So most people who know me know that I don't like to overshare my personal details very much. But in this particular case, I think part of the reason why I didn't want to share a lot of what I had experienced was shame. Because even though, somewhere deep down I knew that this wasn't my fault, there was still a part of me that's like, well, I don't want everybody to know that this is what I'm dealing with because I'm going to have to explain it. But again, I go back to I am done hiding. I am done feeling ashamed for things that are outside of my control. And more than that, I want other people to read the blog, to see my stories, to see whatever, and just at least feel like somebody gets it, somebody understands, somebody sees me, somebody understands what I'm going through. Because I think for all of us, having chronic illnesses can be so painfully isolating and lonely. And when you see somebody who's having that experience, it just makes it feel a little bit better that it's not just me that's going through this. And back to the point about just community is, I can't articulate enough like what this lipedema community has done for me in a relatively short amount of time. I mean, the people that I met in person at FDRS, I had been talking to online for a while, but like that connection was instant. And even people that I met brand new, like the connection was instant. And some some of us were traveling, we're going to be having surgeries, and we're like, well, I'll come with you, and we'll go to wherever. And I mean, after a very, very short amount of time, and I was I was talking to one of the people that I met, and I was like, if we were talking to anybody else and we were like, I met this person online and we're going to travel and have surgery together, I would say you are going to come back without your kidneys. Like, there is no way this is a good idea. Or I'd be worried they've joined some kind of cult. But that's the beautiful thing about this community. There's an instant connection and there's an instant support network that you just can't, I just haven't found anywhere else. So anything that I can do to add to that, to amplify that, I will happily do it, even if it means being a little vulnerable, even if it means sharing more than I maybe like or am used to. I'm happy to do it because the good that it brings is it's going to outweigh some personal discomfort.
Absolutely. I think that's such a good point for how we can use social media to connect and for support. And I think the bright spot, that we found in this corner of the internet is being able to tap into hope, connection, and support. And I really appreciate your transparency in sharing your journey. And kind of, as we're getting to the end of time, it's gone so fast.
I know it did go fast.
As we're getting to the end of the conversation, I would love to spend some time, on that vein of hope, and what does the path forward look like for you?
So for me, I would like to get as involved as I possibly can in this community. So I've been reaching out. I've been working with my personal doctors on just some advocacy work with their patients. One of the things that I do is I take the the Lipedema Foundation pamphlets to every doctor's appointment, because sometimes they'll have residents that are like shadowing them during the day. So I'll give them that, the pamphlets. I'd like to work with them just on some patient advocacy work, just to get as much knowledge and awareness out as possible. Personally, I am still on a path for surgery. That's actually on the horizon for me. In a couple of days, I'll have my second surgery. So that's something I've been kind of focusing on getting myself ready for mentally and physically, emotionally, because that's a big, like I mentioned, it's a big decision that wasn't taken lightly and it requires a lot. So I've been focused on that, but I want to just keep getting involved in this community, meeting as many people as I can, trying to help as many people as I can, and really spending time reaching out to doctors and really getting them on board with this, because we can talk to as, many people as we can online, but doctors who are seeing these thousands and millions of misdiagnosed patients every year, they're going to make a bigger impact. Not to say that our impact isn't important or big, but they're going to see more people than we do. So helping to get them educated and helping them to get aware of what we're going through and how to help us, I think is a key to helping as many people as possible.
Well, thank you so much, Hiba. You've just beautifully shared your story, and I think for those who are watching, even if they don't have lipedema or know someone personally who has it, now that awareness,
Absolutely.
while we're out in the world, will help build empathy and support. And I think the way you live your life out there, literally on vacation, coming in live while on vacation, you're a testament, to what it looks like to understand the diagnosis, look forward with hope, and to share resources so that we can uplift and support the larger community.
Yeah.
So thank you so much,
Thank you
Hiba, for
guys
this
for your time. It was
conversation.
very nice to meet you. And thank you everybody for joining.
Yes, thank you.
All right. Take
Bye-bye.
care. Bye-bye.